Okay, now our next speaker is Floor van den Eynde, and she's going to talk to us about arthrolysis of the PIP joint in Dupuytren's contracture.
Good afternoon. My name is Floor van den Eynde. I'm a second-year resident, and I will talk about arthrolysis of the PIP joint in Dupuytren's contracture. I did this review for my master thesis under the supervision of Professor De Greef. Oh. Yeah. Okay. So fasciectomy could be considered as a golden standard in surgical treatment of Dupuytren's disease, but sometimes in severe cases, no complete extension can be achieved by fasciectomy due to secondary contractions. Mostly in the PIP joints. So in these cases, arthrolysis could be considered, but there remains a lot of controversy. So that was my review question. Does arthrolysis improve the clinical outcome if, in severe cases of Dupuytren's contracture, if fasciectomy fails? For this question, I searched the databases PubMed, Embase, Web of Science, and the Cochrane Library for articles that were comparing the improvement in flexion contracture in two groups, the control group in which only fasciectomy was performed and an intervention group in which fasciectomy was followed by arthrolysis. The primary outcome for this was improvement of the flexion contracture, and this was objectified by measuring the angle of the maximal extension. That brings me to this diagram. I started with 66 articles. After removing the duplicates and then screening the title and abstract, and then the full text, there were 7 records that remained. Newcastle-Ottawa scale was conducted to evaluate the quality of the studies. Unfortunately, the quality was limited, and that was mostly due to lack of control for confounding factors and due to a selection bias. Then there were the results. All the studies compared the flexion contracture improvement in, so first measured preoperatively and then at the last follow-up. 6 out of the 7 studies showed no significant difference, and the 7th study did show a significant difference in favor of the control group. It should be noted that this is only percentage-wise, because that study also showed that in the arthrolysis group, the preoperative measurement, the contractures were more severe in the arthrolysis group, and so in absolute numbers, this group was more successful. Then there were 2 studies who not only measured the maximal extension before the surgery and at last follow-up, but also during surgery and after fasciectomy was performed and at the end of the surgery. This really shows, you can see what happens when arthrolysis was performed. And both of the studies reported that after the fasciectomy, the group of the arthrolysis group showed more severe contractures. And that actually makes sense because these groups, in these studies, arthrolysis was only performed if after fasciectomy there was a remaining contracture of at least 20 degrees. But because of that, the patients were divided in control and intervention group based on the success of fasciectomy, and so the study populations were different for the two groups. And so there's a selection bias. Although the selection bias, we do see that after the arthrolysis was performed, the significant difference disappears. And so maybe there might be a subgroup of patients who do benefit from performing arthrolysis. I think to really objectify this, it would be interesting to set up a study in the future in which the population would be different. So we choose a population of people with severe contractures who do not benefit from fasciectomy, and then from this population make a control group in which you don't do anything further, and an intervention group in which you do perform arthrolysis. So, in conclusion, there remains a great deal of disagreement and controversy in the literature about arthrolysis. There are a few studies that compare arthrolysis, fasciectomy versus fasciectomy plus arthrolysis, and the studies who do have a lot of selection bias, so there's no really straightforward conclusion about this. I do think there might be a subgroup of patients with severe contractures who might benefit from arthrolysis, but further research must confirm. Okay.
Thank you. Thank you. One question to the audience. Do you have many patients who do not recur after fasciectomy of the fifth finger at the PIP joint? How many times do you have a non-recurrence? And what percentage is it then? Okay. So personally, okay. So, I mean, it's. I mean, what your result illustrates is what François Marin-Braun of the Société Française de Chirurgie de la Main showed us about 15 years ago. Don't touch it. I mean, it doesn't enhance anything. It's the only problem. Yes, go ahead. Can you use the microphone? I have a microphone here, but that's more convenient.
Thank you. Was any of the included study randomized trial or?
No.